Carolina is sponsored by...
November is American Diabetes Month, and if you have diabetes, you have a higher chance of developing periodontal disease. Here with us today to tell us everything we need to know, we welcome Elaine Loyack from Delta Dental and Katie Rose Crater from the American Diabetes Association. So glad to have both of you ladies here on set today. Thanks for joining us.
Thanks for having us.
Well, Elaine, we talk about Delta Dental all the time, but just highlight some of the big things that you do.
Okay, so we are a not-for-profit dental and vision insurance carrier. So we offer plans for individuals, families, and employer groups. And we have the largest network of dentists in the state and nation, so that makes it really easy for people to go in network, save money for themselves, as well as save money for their companies.
Which we all love.
Yes, and our mission is to improve the oral health and the overall well-being of the communities we serve, which is part of why we're having this conversation today.
Well, you are so into advocating different areas of our health that we may not always attribute to our oral health, which, Katie Rose, that leads to you.
Yeah.
We're celebrating National Diabetes Month. Celebrate may not be the correct word, but raising awareness about everything that's going on. Why is it so important that we focus on this?
Well, so diabetes doesn't care who you are, where you come from, or how much money you have, where you live, any of those things. Any single one of us can be affected by diabetes, and there are multiple different types. And unfortunately, we are seeing an increase in the rate of diabetes, and especially an increase in the rate of diabetes with children. We're looking at a 700% increase in the rate of diagnosis of children with type 2 diabetes by 2060. So this means that we have an extreme increased rate of people with amputations, kidney disease, heart disease, peripheral artery disease, blindness, dental issues, and hearing loss. So it's really important that we really use November to make ourselves aware of all of the various complications that come from diabetes. In fact, diabetes causes more deaths than cancer and AIDS combined.
I would say it's crucial that we learn more about this disease and how to prevent it.
Absolutely.
Now, the fact that you're both here together, there has to be some kind of correlation between diabetes and oral health.
That's true. So, and it just so happens, I just saw my hygienist this morning and my dentist, so we were talking about this. And if you have, for example, elevated blood sugar levels, it can show up in the saliva in your mouth, and so that elevated blood sugar level can also impact the health of your teeth and your gums. So think about cavities, just like when you have more sugar in your mouth, and then lead to, you mentioned periodontal disease, so gum disease, and that can cause inflammation in your gums, it can worsen your bone structure, and that's what holds in your teeth.
So obviously with all these different things, we may not think about that when we're brushing our teeth or when we're visiting the dentist. I'm sure diabetes is the last thing on many of our minds, but you do have some health tips that we can help to prevent this from happening.
Right, so if you are experiencing inflamed gums or reddened gums, or you feel your teeth are getting loose, make sure you go to the dentist and let them check. When you do go to the dentist, if you've already been diagnosed with diabetes, make sure you tell your dentist that you have diabetes, and they can help monitor those signs. What research has found that I think is fascinating is that 4 cleanings a year for people with diabetes can lower their A1C level by 1 point, and an A1C level is the average blood sugar level over a specific period of time, and it's important to monitor those numbers.
That's huge. That has to be a huge drop that's going to help so many patients that already have diabetes by just an easy healthcare routine procedure that we can have done 4 times a year.
Absolutely. That could mean the difference between diabetes and prediabetes. And, you know, that can mean a huge impact in the quality of a person's life. Anything we can do to reduce our A1C, to keep it within a healthy range, is going to keep us alive, healthy, and thriving longer.
It really is incredible how our bodies correlates with everything all together. We work as a whole, and it's so important to pay attention to every part, and our oral health is just so crucial pretty much in everything. It seems like it's an indicator for so many different diseases and issues that we can be having. If we need more information on Delta Dental and all the providers that you work with, where can we go for more information?
Go to deltadentalnc.com.
And Katie Rose, with the Diabetes and Diabetes Month, where can we go to learn more about that, maybe see how we can get help if we feel like we are maybe prone to getting it, or how we can prevent it from even happening in the first place?
Sure. So the best place to start is diabetes.org. And then from there, you can take your risk test there. It's a really quick 5-question quiz that tells you how at risk you are for developing diabetes. You can also check out American Diabetes Month within the website. And if you want to come out and get your A1C tested, get your teeth checked, get a vaccination, we'll be having an event on November 18th. Delta Dental is a generous sponsor at Durham Technical Community College.
Fabulous. What a great opportunity to go out there and get it all done and talk to the experts all in one place. We appreciate you all and your organization so very much for what you do. Thanks so much for coming in.
Thanks for having us.
Thanks for having
Katie
us.
Rose.
The preceding was sponsored by